Chronic pain, what it is and what causes it, coming up. Hey everyone, Dr. Sam here with Gumshoe Health, helping you take your health to the next level. On this channel, we do holistic health news, information, tips, and reviews. So if you're new here, consider subscribing. And at any time during the video, if you'd like to check out the show notes in the description below, I'll make sure to highlight all the main points as we go along. On this video, we'll be giving some background information on chronic pain. What is it? What causes it? How it's diagnosed, what can make it worse, and treatment approaches. So what is it? The easiest and shortest answer is that chronic pain is the continuous firing of nerves, sometimes even after an injury is healed. Sensory nerves in your body send electrical signals to the brain, and the brain then interprets those signals as pain when they were originated due to an injury or some sort of damage resulting to the tissue of your body. Chronic pain is when that sensation lasts 12 weeks or longer. So the idea here is really that it persists and it won't go away. This sensitization of the nervous system really leads to the general treatment approach, where we really want to try to reprogram that pain or, of course, resolve the issue that's causing the pain in the first place. So there are a lot of different causes of chronic pain, but they generally fall into three main camps. And one of those is going to be with initial injury, so like a car accident. Another one is going to be from ongoing disease process, such as osteoarthritis. And the third one is actually an unknown. Like, we're not at a point in our medical science to actually be able to determine what it is that's triggering that pain. The diagnosis of chronic pain is heavily reliant on patient description. So in terms of location, intensity, duration, all that kind of information, as well as what caused it in the first place, what's been identifying as continued to trigger it. So with all of this, there are actually several things that can make the experience of the pain worse for you. So it's really important to be aware of this, and quite frankly, it sucks because a lot of these things kind of enter into a vicious cycle with patients. So things like lack of sleep, which you might be getting a lack of sleep because you're in pain, but then the lack of sleep then makes your experience of the pain worse, and it just kind of continues on like that. But anything you can do to address these things will generally decrease your experience of pain. So lack of sleep, mood changes, anything that's associated with a decreasing mental health picture. For a lot of folks with chronic pain, it can all seem pretty hopeless, and you're going to do whatever you can to get rid of it. And this, of course, all brings us to treatment approaches. There are a lot of different approaches and a lot of different methods to try out, so there's definitely a good variety of things that we can experiment with to help you with your pain. As naturopathic doctors, we'll always be looking to the root cause, so while we're trying to manage pain and increase function, we're also going to be looking at what is the cause of this and can this actually be addressed. Sometimes it can't be, and that's fine. We're definitely going to then focus on improving function and managing that pain so that you can continue to live the fullest life possible. So approaches out there for pain management can include things like pharmaceuticals, botanical medicine, physical medicine. So that's going to include things like massage therapy, adjustments, hydrotherapy, all of those types of things. And then we've got things like Tai Chi and counseling and all these other elements that we could go down. At the same time, we're going to be wanting to manage those concomitant side effects that we talked about before, like the sleep deprivation, like the mood changes, like the decreasing mental health picture. So that way we can bring your experience of the pain down to a much more tolerable and manageable level by hitting it from these kind of multi-vector approaches. All right, thanks for watching. I will try to make some more specific videos about those different approaches that we talked about, but I do know that the general picture wants answering as well, so I hope I address that today in today's video. If you liked our video, then please subscribe if you haven't already. And question of the day is going to be, What have you found that works for your chronic pain that you've experienced? And if any of these approaches have worked best for you, how that went down and why. And remember, the best tips, information, and exchanges always happen in the comment section below, so please make sure to connect with everybody there. This is Gumshoe Health, helping you to take your health to the next level. Take care, and we'll see you later. Interprets those signals